This is how we use the cervical traction units. Cervical traction units are important for anyone with a chronic shoulder or upper neck issue, and especially in correcting forward head posture, which is the posture we get from spending a lot of time at desks, or a lot of our daily life is actually spent sitting, working in front of us, driving a car, we eat in front of us, if you're sitting on the couch watching TV, and what happens is the head starts to come forward. And it puts a lot of pressure on the muscles on the back of the neck, and we often will say, oh, they feel tight, they feel sore, but really they're working too hard. And they're working hard because they're trying to hold our head over our spine, and it's the job of the skeletal system to support our body against gravity, not the muscles. So we really want to ease a lot of our muscle pain by preventing the muscles from doing all the work, and making our skeleton get aligned so that it can do the job it was meant for. So two of the devices, Pettibon over-the-door cervical traction units. This is the regular one. This is what's called the fat roll. We'll talk about that in a moment. And in terms of trying to get my head to come back over my shoulders and also increase the space between the discs, I need something that's going to counteract gravity, the weight of my head, and the repetitive exercises and stuff that I do all day. So we're going to place this portion behind the occipital ridge of our head, and this foam roll here was going to go under our chin. And I'm just going to demonstrate this. We usually do about 40 repetitions, but we start with about 20, and as long as you don't feel flared up and you feel okay, the next time you do them you can add 5 or 10 repetitions, but just go based on your comfort. Okay, so I'm going to place this under my chin, my hands face my face, this is under the back of my neck, this piece is under my chin, I can still talk, and I'm just going to drop my knees, staying really close to the wall. Inhale, exhale, come up, and repeat. So by doing this, I get a kind of a pumping action that is pulling my head up, and you can see as I drop down, this lifts my chin, and it's taking away that straight neck and starting to induce a curve back into my neck. If I do not perform the necessary strengthening of the posterior neck structures, which are in another video, I won't hold this position. Okay, but this is very important in opening up the spine, especially for our patients who have really sharp nerve pain coming down their neck. And this exercise is something that you should really consider to do for one season, which is about 3 months, to really see where it goes. We have x-rays showing people with reduced disc height or degenerative disc disease, maybe 2 or 3 millimeters high, and after a few months of doing the routines that I'm giving to you, they come back, not only are they taller, everything's lined up, they feel better, but the x-ray will show itself that their disc height now has been 3 or even 6 millimeters of gain, that we've pulled the muscles out of spasm, we've pulled water by creating this pumping action, we pulled water into the closed system of the spine and hydrated those discs. Because what are you doing to rehydrate the discs? Well, we know that our weight and our daily activities of gravity and everything compressing us is not helping us to rehydrate, okay? The way that we use the fat roll, this is designed for people who, some people might have pain when they do this, their neck might be that compromised, or they might have TMJ pain, trigeminal pain, jaw pain of some sort, so they can't have anything on their jaw. Okay, if you can't use the standard, we're going to use the fat roll. Fat roll is a little different in that we still put this V under the occipital ridge, but we place this on our forehead, and we make an adjustment so that we are comfortable. I place this on my forehead, my legs stay close to the wall as possible, and I'm going to just drop my head down and let my back up. So there we go, and inhale, up, down, up. Okay, let me move you around so you can see what's happening with my legs. Okay, so I'm staying as close to the wall. My forearms are actually on the wall or the door. I'm going to move my feet, but I'm going to keep them wide like in a squat. And I'm going to drop down. I'm going to let my bottom exit out. There we go. It's okay to let your knees hit the wall like that. What's important is that my head is being pulled up as vertically as possible, and I'm not leaning back. I want to pull my head straight up, not lean back and pull my head forward. The cervical traction routine should not cause pain. You may feel a pulling. We start off with about 25 repetitions. Inhale on the down, exhale on the up. Keep in mind what we're trying to do is pull the spine apart to pull water into it. We want to build up to 40 and eventually 60 repetitions of dropping down, coming up, okay? It's not terribly time consuming, but it is something you want to build up to, and it is going to take several weeks. You may start to see changes in, especially relieving pressure if you're really compressed within a week or two. But to get the full results, this is something that should be implemented on a regular basis in your daily life. But in the initial 3 months, it's something that you really should do 5 days a week, if not all 7, to really help hydrate that spine.